the signs and symptoms of a stroke? It's important information to know, so our next guest is here to answer some of those questions. Please help me welcome back Dr. Jabbar, an interventional cardiologist at Cardiovascular Institute of the South. Welcome back, doctor.
Hey, how's it going? Thank you for having me again.
It is going good. Thank you for coming back onto the show because, I have an uncle who went through a stroke and he's still dealing with those results from a stroke. So I'm so glad we're talking about that this morning. First, let's start with what a stroke is. What can you tell us?
So simply put, a stroke is basically a major medical event in which the arteries that are leading to the brain or within the brain have some sort of blockage, and that could be for various reasons. And it's basically the brain is not able to receive oxygen, nutrient, blood to the tissue. The interesting thing is the brain makes up about only 2% of the body's mass, but it consumes up to 20% of the oxygen in your blood. So during the event of a stroke, you have either a clot or a rupture in the artery that prevents that oxygen from being delivered to the brain. And that tissue in the brain is responsible for various activities within your entire body. And so that's how you end up having an event where that brain function, controlling whatever it is that it controls, basically doesn't work properly anymore.
And now that we know what a stroke is, it's important to identify what the symptoms of one is. What are some of the symptoms?
So various symptoms you can look out for, things like weakness or numbness in any part of the body, not, face, arm, leg. A lot of times people who have a stroke will have a deficit in one part of the body or one side of the body because usually that artery supplying one side of the brain will affect one side of the body. And so that's how you can easily identify it. Things like confusion or difficulty in speaking or understanding speech. Sometimes it could be something like just blurred vision or some dimness in your vision. So the stroke, the burden could be very little or very large depending on what part of the brain is affected. You can have problems with just movement itself. It could be as simple as just a severe headache with nothing else known to cause it.
And when we're talking about this condition, are there more people at risk than others? Because let's be honest here, doctor, anybody can have a stroke.
So a stroke, underlying risk factors is the same as things like coronary disease. So things that can lead to blockages in the arteries are usually the risk factors. So people with high blood pressure, high cholesterol, a history of artery disease in other parts of the body, such as peripheral artery disease, coronary disease or heart disease, and carotid artery disease. So carotid arteries are the arteries that supply blood directly to the brain that are found in your neck, and any sort of blockage in those arteries puts you at risk for a stroke in the future.
And doctor, preparing for this interview this morning, one thing I found really interesting that I didn't know is that there are different types of strokes. Please explain a little bit more about the different types.
So the different types is just basically focusing on the mechanism that's responsible for causing the stroke. So like we said, we're just really focusing on the fact that there's something that's inhibiting blood flowing to the brain. And the most common cause for a stroke is something called an ischemic stroke. And that's just simply explaining to you that something is blocking the blood flow. Ischemia is essentially the lack of oxygenated blood reaching the brain tissue. And that could be from a clot that makes its way into the arteries of the brain from somewhere else, most commonly a small clot that originates in the heart, or it could be from a clot rupture or a plaque rupture in the arteries of the brain that blocks the arteries. So that's the most common cause. Another cause is hemorrhagic stroke, which is basically an artery in the brain that is perforated and leads to a bleed, occasionally a catastrophic large bleed that basically will put pressure on the tissue and lead to damage in the brain tissue. And the other type, another common one we see is a transient ischemic attack. And that's commonly seen in people who have very high blood pressure, where essentially you have such a high blood pressure that the regulation of the pressure in the arteries leads to decreased blood flow to the brain tissue.
And isn't there another name for the transient ischemic attack? Isn't it like a small stroke or a slight stroke, something like that?
So a lot of times that can be called a mini stroke or a minor stroke. And a lot of times people call it TIA, which is short for transient ischemic attack.
Wow, really interesting. And like I was telling you, doctor, my uncle, he had a stroke, and going through life after a stroke can be a little bit difficult. Like, he had slurred speech, so he had to go to speech therapy, and he still struggles sometimes to speak. What is life like after a stroke? And another question I have for you is, if they've had a stroke once before, is it possible for them to have it again?
So to answer that part, yes, if you've had a stroke in the past, usually you have risk factors, and so you are at risk for another stroke. In terms of life after a stroke, it really just depends on the severity of the damage to the part of the brain that's affected. And so whatever, whether it's a large stroke or a minor stroke, that will dictate how you recover. Obviously, your age, someone who has other medical problems, or their overall health is not as great as, let's just say, someone who's of older age and has multiple comorbidities. They're less likely to recover from a stroke than someone, say, of a younger age who has no other comorbidities. But the thing that really is going to determine how well you recover is what is affected by the stroke and how large of a hit someone takes. Obviously, someone who has a stroke that affects their ability to use their muscles or move a limb will be limited from that, versus someone who just has a stroke that affects their speech, right? So that you can carry on doing activities, but your speech is affected, versus someone who has weakness in an entire half of their body. It's going to take a lot more work for them to recover. And that's why things like speech therapy, physical therapy, occupational therapy are very important in the recovery process.
It really is an interesting conversation, and I could talk to you all day, doctor, about this, since this does hit so close to home for me. But look, we are out of time. And here's the good news. If you have more questions or want more information about heart health or strokes in general, log on to cardio.com or give them a call at 504-354-5252 to see what Cardiovascular Institute of the South can do for you. They are located at 1901 Manhattan Boulevard, Building A, Suite 200 in Harvey. Stick with us. We'll be right back.